Hey everybody, I'm joined here with my friend Dr. Shah. We've been friends for a couple years on Facebook. We have a very similar journey. We're both following a whole food plant-based diet. We've reversed health conditions. We've both lost weight. And I wanted him to share his story because I think you'll be very inspired by his story. Dr. Shah, can you take us back to the beginning and tell us a little bit about your practice first and what led you to
Definitely.
becoming plant-based?
Yep, definitely. So again, Richard, thank you for inviting me on your page and on your channel. I'm Dr. Aajay Shah. I'm been a board certified cardiologist for the last 26 years. Matter of fact, I started my medical school 41 years ago. So that was many, many decades ago. So I have a lot of experience on my belt now. I also got board certified into lifestyle medicine. I work as a full-time employed cardiologist for a small community hospital in Michigan. And my journey started on this healthy lifestyle actually about 4 or 5 years ago. October 6, 2016, my A1C, which is the measure of diabetes, came back 5.9. So I was clearly heading towards full blown diabetes. And I did not want to become a diabetic, did not want to go on medicine or insulin. Many of my uncles on my mom's side have type 2 diabetes, and many of them were on insulin. I did not want to go on any of those medications. So I made pretty much overnight change. I became whole food, plant-based, no oil person. I realized even as a practicing cardiologist, the knowledge about nutrition for physicians is very limited. We don't get adequate training about nutrition in our medical school or our residency or our fellowship. So I had to pretty much restart the learning about nutrition and about the 6 pillars of healthy lifestyle. I read tons of books from various authors, including Furman and Esselstyn and Ornish and Michael Greger, many authors, all the pioneers into whole food plant-based movement. I watched tons of videos. I read many textbooks. I read also textbook for the lifestyle medicine, and I realized that that's the way. That's the only way, not just to lose weight, but to get healthier. Over 6 months, I lost 50, 60 pounds. My pre-diabetes was completely gone. My A1C now runs 5.1, 5.2, which is probably one of the best A1C you can get at my age. My triglycerides, which were upwards of 400, now they're on 60 to 70 range, which is an extremely good number, very, very healthy number. My waist diameter, which was 41, 42 inches, now is 32, 33 inches. My weight has been stable. Now I still need to lose about 10 or 15 pounds, but I'm at a very healthy range. I'm no longer obese. I'm no longer overweight. I'm below overweight category now. And I'm absolutely enjoying all the benefits of those healthy lifestyle changes. My energy is to the roof. I work full time. I commute 2 hours. But even with those two responsibilities, I still manage a busy Facebook page, a busy YouTube channel. I give a lot of lectures. I spend time with the family, with my wife, with my friends, and I'm always busy. I'm always up and the go. I ran, matter of fact, 2 half marathons since all this thing started, and I'm preparing and training right now for a full marathon. So benefits, just like Richard has experienced, and we can see on Richard's page and on his YouTube channel what he is enjoying all the benefits of becoming whole food plant-based person, no oil person, along with regular exercise and sleep. I'm enjoying the same benefit. So I actually invite all our listeners and followers who are watching this together with Richard that you can achieve the similar results by going whole food, plant-based, no oil journey, along with other 5 pillars of healthy lifestyle.
Exactly. And yeah, I have to say that if anybody wants to take up the journey, you'll be amazed with the benefits. It really is the best way to live, in my opinion. You feel great, and yeah, you're living proof as well.
Yeah, yeah.
So my next question is, what are the top 5 diseases that you think could be prevented or reversed with a whole food plant-based diet?
Yeah, that's an excellent question. Matter of fact, when we talk about whole food, plant-based, no oil lifestyle, along with 5 other healthy pillars, you can reverse most chronic disease, but we will go with top 5. Number one, I call obesity a chronic disease. Even though obesity may not be classified as a disease, but obesity, in my opinion, is a chronic disease because Not only obesity leads to premature death, but it leads to many complications, just like many other diseases can lead to complications. So obesity can be reversed completely by whole food, plant-based, no oil diet. How can that happen? When we eat whole food, plant-based, no oil diet, the calorie density, that means how many calories food will give you per pound, is significantly low. We all eat about 3 to 5 pounds of food per day. That's how our body is designed. That's how our stomach is designed. Our body cannot go without eating 3 to 5 pounds food per day. When we eat those calorie dense food, that means high calorie per pound, like the standard American diet with a lot of processed food, a lot of animal products, a lot of oil, those food, when we eat 3 to 5 pounds, gives us calories anywhere from 2,500 to 3,500 calories per day. And that's about 3 to 500 calorie extra per day compared to 40 or 50 years ago. When you go on a whole food, plant-based, no oil lifestyle, your calorie density, that means how many calories you will eat per pound, goes down, because plant-based food, whole food plant-based food, has a two important ingredient which does not give you calorie but gives you the volume. That means it bulks up the food without adding any calorie. And those two important ingredients are water and fiber. Many processed food don't have water, don't have fiber. Many animal products don't have water and definitely don't have any fiber. So when you eat whole food, plant-based, no oil diet, it gives you a lot of water and a lot of fiber in that food. So you have less calorie per pound. Most whole food, plant-based, no oil eating person typically will eat anywhere from 1,500 to 2,000 calorie per day. That means average you will be eating anywhere from 500 to 1,000 less calorie per day if you go on a whole food, plant-based, no oil diet. That means if you go on that whole food, plant-based, no oil journey, you'll be losing 1 to 2 pounds per week without feeling any hungry, without feeling that you are starving yourself, without depriving you of any food, without any portion control, without any calorie counting, without following any points like some of the other organizations do, you'll be losing weight automatically. So again, obesity, one chronic disease you can reverse easily. Second chronic disease you can reverse is the heart disease. As we know, heart disease is number one killer in America even today. It kills more people than COVID every year. So heart disease is number one. Dean Ornish in 1991, matter of fact, proved that by going on a plant-based diet with some other healthy lifestyle changes, you can actually reverse the disease, and he proved it by doing angiograms on patients. So definitely we have proof that heart disease can be reversed by going plant-based, particularly whole food, plant-based, no oil diet. So heart disease can be reversed. The third disease which can be easily reversed is high blood pressure. When people go on a high whole food, plant-based, no oil diet, they will start losing automatically. Particularly if they also include no salt in their diet, blood pressure will normalize. I've seen many patients, including myself, going off blood pressure medication once they go on whole food, plant-based, no oil, no salt, no sugar diet. Next disease one can reverse is Alzheimer's disease. Even though Alzheimer's disease many times in an early stage can be reversed, advanced stage may be difficult to reverse, but there are some trials going on to see even advanced stage can be reversed. But people who definitely have a very early cognitive impairment, they can stop the progression of Alzheimer's disease. They actually can slightly reverse the Alzheimer's disease by going on a whole food, plant-based, no oil diet. Whole food, plant-based, no oil diet also can actually help to prevent many cancers. Animal products have animal protein, which actually can stimulate IGF-1 pathway, which can lead to many precancers and cancer cells. So people who eat whole food, plant-based, no oil diet can prevent many cancers. There's actually some data that people who already have developed cancer, like for example, breast cancer, if they go on a whole food, plant-based, no oil diet, the recurrent second or third breast cancer chances are less on a whole food, plant-based, no oil diet. So again, obesity, heart disease, high blood pressure, Alzheimer's disease, many cancers. And the next one, which is the most important one, is the pre-diabetes and diabetes. Type 2 diabetes is mostly a disease of diet or food we eat. If we go on a whole food, plant-based, no oil diet, the fat content in our diet goes down. And now we know the mechanism of type 2 diabetes. It's the fat, it's the lipid in the muscle cell, liver cell, pancreatic cells, and many other cells in the body. When you go on a whole food, plant-based, no oil diet, automatically the fat percent of your calories goes down. And many times you are eating anywhere from 10 to 15% fat calories in your diet every day. And that start to reverse the insulin resistance, that start to reverse the obesity. And many type 2 diabetic patients actually can reverse the type 2 diabetes completely. They can get off the insulin. They can even get off the many of the expensive newer medications. So this is just the tip of the iceberg. There are many, many more diseases one can reverse, including sleep apnea, including chronic kidney disease, including fatty liver disease, including many, many other diseases one can reverse. But these are some of the top common disease one can reverse with whole food, plant-based, no oil diet.
Now, how long does it take, do you think, for somebody to see the health benefits?
That's an excellent question. Matter of fact, if you look at some of the studies, when a person is given a burger, a animal product, the fat and saturated fat in that diet, in that item, the blood vessels in the body starts constricting within few hours. And if the same person is given a plant-based diet, like a large salad, those blood vessels start performing back to normal. So benefits can be actually experienced within even hours and days, and there is a proof to it. If you look at some of the scientific studies, blood vessels starts changing within hours and days of going plant-based. So benefits would be within hours and days. In terms of some of the other benefits, you will start seeing those benefits in weeks and months. Reversing type 2 diabetes, you can see it within even 1 to 2 months. Yeah, a person, if loses 10 to 15% of the weight by going on a whole food plant-based diet, which they can achieve easily in 1 to 3 months, the type 2 diabetes can be gone in 1 to 3 months. Blood pressure benefits can be seen in also in days and weeks. So I think, again, the benefits of a lot of these changes can be seen within hours to weeks to months. And definitely when you do it for 3 to 6 months, it's a life-changing experience.
Oh, for sure. How long, if you don't mind me asking, how long did it take you to reverse your A1C so it got lower?
It was 3 months.
Wow, that's impressive.
Yeah, I mean, I was myself was surprised the diet can do that.
And my next question is, are there certain foods, I know all plant-based foods are healthy, but there certain foods that people should eat every day or they should focus on?
Yeah, that's a good question again. So I think I highly recommend all my patients, and I try to follow myself the same thing, is that we should be eating green vegetables, particularly cruciferous vegetables, every day. At least 1 pound of cruciferous and green vegetables every day. And either you can cook them with the water or vegetable broth, or you can just eat them raw, maybe half and half. So definitely green vegetables every day. I think ideally every meal should have green vegetables, in my opinion. Breakfast, lunch, and dinner should have green vegetables. The next thing every day should be eating is fruits. Any kind of fruits are okay, but mix and match them. Berries are preferred. Apples are preferred. Apple has certain substance which can lower your cholesterol. Orange is preferred. Any fruits are fine, but definitely have 3 to 5 servings of fruits. Next thing is having intact grains like black rice, brown rice, quinoa, oat groats, many other intact grains, because we know grains actually gives us the higher calorie per pound. So people who are active, they need higher calorie per pound. Also, grain have also shown to cause lowering the chance of heart disease, particularly when you eat intact grain. It also lowers your cholesterol when you take intact grain, like oat groats, for example. So I definitely want people to have intact grains every day. I also want to have people a small amount of nuts, like 1 ounce of nuts, and small amount of flax seeds or any kind of seeds like chia seeds or sunflower seeds, any kind of seeds. I also want people to have everyday cooked legume, beans or lentils, because it's a good source of plant-based protein. So people should definitely eat some form of plant-based protein with each meal, either beans, legumes or lentils. I also like to have our viewers reminded that Dr. Furman gave us a grain mnemonics, and it goes by G bombs. That
Yes,
means
I follow that every day. Yeah.
which goes by green vegetables, tea for berries, which we talked about, or any kind of fruit.
Oh, I'm sorry, you're breaking up. Your microphone, for some reason, it started to
Yeah.
break up there.
So again, I
Oh,
think
that's
we
better. Yeah.
Yeah, we should be reminded from Dr. Furman when he says that we should be eating G bombs every day, and those G bombs include green vegetables like we talked about it, berries or any kind of fruits like we talked about it. O is for onions, M is for cooked mushrooms, other B is for beans, which we talked about it, and then seeds. So again, onions and mushrooms definitely should be eaten every day. Mushrooms definitely have certain chemical substances which can prevent many cancers. So again, have variety of plant-based food. If we talk to Dr. Bilsowitz, the person who recommends this high fiber diet, and he has a written book, Fiber Fuel, he says that even we are whole food plant-based, we should have variety of plant-based food on a weekly basis. That means within a week, we should be eating minimum 30 types of different plant-based food, obviously whole food plant-based food, minimum 30 items. So I'm not saying people should count what item they eat, but at the same time, have a rainbow diet. That means the plate should include all varieties, different food for breakfast, lunch, dinner. At the same time, I also believe that sometimes keeping it simple helps to transition from standard American diet to the whole food plant-based diet. So if you like 10 or 15 items from the whole food plant-based, that's okay to keep eating them until you graduate and then you start adding more and more variety. So I personally believe in having variety, minimum 30 variety per week. But if you are starting, if you want to limit to 5 or 10 whole food plant-based items, that's okay too. But eventually, you should be eating your rainbow diet.
Oh, for sure. Totally agree. What are your thoughts on the vegan meats? Personally, I avoid them. Do you think they serve much of a purpose, especially for ethical vegans?
Yeah,
Do you
I
consume them
think
yourself?
those food have a place and a purpose. For example, if a person is eating, a beef-based burger, going to this meatless burger would be a good transition food. But eventually, they should graduate to a homemade bean burger, which would be much less processed. And again, this Beyond Meat and Impossible Burgers, they have obviously no meat in them, but they still have a lot of saturated fat. They still have a lot of oil. They still have less fiber than the one you make it at home. They still have a lot of many other chemicals. So I think those burgers are good for environment. The meatless burgers are good for environment, good as an ethical vegan. But definitely in terms of personal health, they are good transition food. But you cannot stop there. You have to go beyond that and start making your own bean-based burgers.
Yeah, totally agree. How much exercise do you advise your patients?
That's a good question. Again, when we talk about exercise, our College of Lifestyle Medicine uses the term physical activity because physical activity is a better way to describe how we should be moving than exercise. That means we should be moving every hour. Even if you are working 8 hour desk job, you can get up every hour for 5 minutes, 7 minutes. Just do some squats, just go for a quick walk, go to a water fountain, go to bathroom, take few stairs here and there, but move 5 minutes. And most employers actually allow now to move 5 minutes every hour. If you're working from home, definitely move every hour for 5 minutes, 7 minutes if you can, number one. Number two, incorporate physical activity in your life as if it's like a normal thing to do. For example, vacuuming the house, gardening your garden, or shoveling the snow, or cleaning the windows, or whatever things you like to do, whatever work you do, do it. Go for a walk with your spouse or with your friend or with your partner. Uh, at the same time, doing some kind of structured exercise is also very important. That means either fast-paced walking or jogging or running if you can, if your body can allow it, or doing some kind of cardio exercise like elliptical or stationary bike or outside bike. You can do that. Also, doing regular strength training is very important too. That means lifting light weights depending upon your ability or capacity, or using some machines to lift the weights, or doing even calisthenics, or even just doing some squats and some push-ups. So those things are very important. Also important is the stretches and yoga type training, because as we get older, our body, our ligaments start to get stiffer, and maintaining the flexibility is very important. That's what I think doing regular yoga, regular stretches would be very important. And last thing, when it comes down to physical activity, some kind of balance training is also very important because as we get older, particularly after 70s and 80s, fall becomes a major issue. And if you have proper balance training, you can avoid many fall and can avoid many disasters. So to answer your question, you can incorporate all this thing, everything I described in about 30 to 60 minutes a day. And that's not too much to ask. I think if a person minimum should be busy for 30 minutes and then they should be moving all day, every hour with all different type of physical activities, including household activities, whatever they like to do.
Right.
And they should be doing additional 15 to 20 minutes of weight training or strength training, 5 to 7 minutes of stretches, and 1 to 2 minutes of balance or fall prevention training.
Yeah. I gotta say, I wear the Apple Watch, and that reminds me every hour. That's been a blessing for me because I get so involved in the work, but I need that reminder to get up.
Yeah, yeah.
I also have to say I agree with you about the balance. I've had a knee injury that's gotten better, but the thing is, I learned how to balance more with physical therapy. All those things are a benefit, and I didn't realize how tight I was. Well,
I think after age 80, if a male falls and breaks the hip fracture, he has a higher chance of dying than a chance of dying from a lung cancer. So fall at age 80 and a hip fracture is more dangerous than a lung cancer.
Yeah, my dad was lucky. Not that he fell, but he didn't break anything. He fell on his hip a few weeks ago.
Yeah,
He's sore, but he had it checked, and he's very lucky. I know what you're saying, and that's true. Yeah. My next question is, how do you transition your patients to a plant-based diet? Do you take a slower approach, or what do you think is the best way to do it?
I think it depends upon the readiness of the patient. Some patients who actually are suffering from chronic disease acutely, they are so motivated, they want to do it overnight. So I encourage them to do it, that's okay. But most of my patients actually do it in a gradual way. And I think I would say the ratio is about 80-20. 80% do gradual way, 20% do overnight. They just change it. Some people have stronger willpower, they can do it overnight. But the way I ask my patients is that maybe make one meal whole food plant-based out of 3 or 4 meals they eat. Or maybe make one day whole food plant-based, no oil. And once you do that, you will start to feel better after that meal. You will be less sleepy, you'll have more energy, your stomach will have a less reflux, and you will just feel better. And once you get the benefits of that, eating one meal per day, you automatically will reach out for second meal, third meal. Same way in the house, the same recipes you are using, start using the plant-based substitutes. And you start to realize that not only it helps you to lose weight, but it also makes you feel better. So again, transition, it gradually is a better way to go for most people. I would say 80% of people are gradual. At the same time, if someone, like I had one patient just a few months ago who had a heart attack and got many stents, he came to see me in the office and he says, I want to change overnight. He was so ready and he made those changes in one day. He just asked me, I gave him the It to Live book. I gave him some videos to watch. And I saw him in a month and he was a new person. He had changed his life completely. But typically, those are rare exceptions. Most people do it in a gradual way.
Right, right. Now, what is your patient's response when they first hear about it? I know I've heard stories where some people think it's too extreme. The personally, I think heart surgery is too extreme. I mean, is it a mix of responses or?
Yeah, I think it's a mix of a response, but you said in a very right way, because I asked the same question to the patients that which one is extreme, a heart surgery or eating some salad, which one is more extreme? And I think giving that kind of example or taking insulin versus eating vegetables and fruits, which one is more extreme? I think when you give that kind of example, people start to realize that changing lifestyle, I think many food companies have brainwashed people and many fast food at every intersection. I think right now, to be honest with you, Richard, I think the environment is set to fail us when it comes down to healthy lifestyle. Because every food, every restaurant, every fast food, every grocery store is loaded with processed food and animal products. Whenever we open our eyes, first thing we see is a standard American diet. We don't see a whole food plant-based diet. So it's very hard. So many of my patients, many times, they also feel that it's going to be very hard for them. But I show them that if you start watching videos on YouTube, most people have YouTube access now. If you just start reading It to Live book, which is only $10 on Amazon, a used copy, if you read that book, I think the chances of converting them to a believer of whole food plant-based diet is much higher. So I do it in a very diplomatic way. I educate them. I make them aware of benefits of whole food plant-based and the issues and side effects of continuing to eat standard American diet. And once they become knowledgeable, they become easily a follower and a believer, more so than me just telling them to do it. I actually sometimes give them 1 to 3 months, Richard, to even acquire the knowledge. Acquire the knowledge. I don't even push them. I don't even force them. Many of them, I just give them the book and I ask them to watch some videos, see them in 2 weeks again after they have done the homework, and they come with more questions and I answer them. And many times it takes them 1 to 3 months before they become a full 100% follower.
Yeah, and then they never want to go back, I imagine, most of them, because you feel too good after that.
Yeah.
Is there one certain doctor, because I love all the plant-based doctors, but for me, Dr. Furman was the first and he really changed my life. Is there one certain doctor for you that you think really pushed it home about making the changes? Or
Actually, Richard, you and I are in the same boat. I saw Dr. Furman's PBS special and he converted me completely to go whole food plant-based. And I have given out his It to Live book to at least 500 patients. What I do, I buy them in bulk from Amazon and I just sell them price to price, because that way patients don't have to wait for book to come. When they leave my office, they have a book in hand and they can start reading it as soon as they get home.
that's a great
So I just buy, like I buy 10, 15 copies at a time. And I typically buy for anywhere from $10 to $12, and I just charge them $10, and they're just whatever the price is. And that way they don't have to. Many of my older patients don't have Amazon accounts sometimes,
right.
And sometimes library may not have the copy anymore because a lot of people have been using that book. So I just get in bulk and just give it out to people. So again, Dr. Furman, just like yours, is my savior.
Yeah, I love that.
Yeah.
What are your future goals? I know you mentioned a marathon. Is there any other goals you want to talk about? Or?
Yeah, I think I want to lose my last 15, 20 pounds. I want to eliminate my belly completely. I still have small belly. I never want to get diabetes. I never want to get heart disease. I want to live long. I want to have a lot of happiness. I want to collaborate with a person like you and spread the message. I admire what you do. I mean, because not only you work full time, you take care of yourself, your own health, your family, your father, but at the same time, you are very active on your page, on your YouTube channel. You comment on all the posts of all the live I have. You always are gracious enough to ask questions and teach us when I am live on my page. So I think I want to be someone like you. I think I want to continue to be healthy, but at the same time continue to help people to be healthy also.
Yeah, that's the important thing, to help others. I always say if I could do it, anyone can. And I truly believe that, because you just got to try it. So,
Yeah.
well, thank you so much for joining me.